Hey everyone, my name's Privia and I'm a third year medical student at the University of British Columbia in Canada. And today what I want to talk about is how I study in clerkship. I made a video last year about how I studied in pre-clerkship. I think I was in second year at the time, and I'll link that above here so you can check that out if that's of interest to you. But basically, in clerkship, the style of learning is so much different than it was previously. Basically, in clerkship, we're at the hospital every day and we're working entirely on a clinical basis. For those of you who don't know, the way that clerkship is broken up for me this year is that there's 4 main blocks that we have. And based on my schedule, there was a women's and children's block first. Right now, I'm in my surgery block, which means that I have 4 weeks of general surgery. I had 2 weeks of orthopedics. I had 2 weeks of plastic surgery, 2 weeks of urology, and now I'm just coming on to my 2 weeks of anesthesia. And at the end of that total of 12 weeks, we're going to have another block exam, just based on what we learned during that surgery block. The first thing is, what do you need to know in clerkship? So this is a tricky question and it depends on what your goals are. There is essentially a 5-year specialty dedicated to each block that we're on right now. So what you have to get used to is knowing what is really important and what do you need to take from your experience. So part of it is what is going to make me a better doctor in the future. Another part is how am I going to succeed in these 2 weeks during this block that I have, and what skills do I need to learn based on the objectives that UBC has essentially set out for us. And the third thing is that we have an exam at the end of the day, and there are certain things that I need to know to do well on the exam. Ultimately, I'm not going to move on to next year if I don't pass this exam. But the thing is that what I want to take from this block in terms of making me a better doctor in the future, it may not translate to doing well on the exam that we have at the end. So that's why my mindset when I'm going in is that I have 3 different goals essentially. And a part of my studying, a part of my learning is going to be directed individually to those 3 goals. And hopefully in the end, that'll make me a better physician. So with that being said, how much do you really need to know? My advice is to have some sort of framework and have an objective of what you want to do and how much you want to know. For you, is that learning the pathophysiology of every disease, knowing the potential side effects of every medication, or I should say the common medications that you use during that block? Do you just want to be able to answer the questions that preceptors ask you on your rotation to make you look good, to give you some confidence? Because that is a potential strategy as well. Or is it only about the final exam for you? Is your main goal to pass that final exam? Because really, you might not be interested in surgery at all. So you might not actually want to take a lot from that block, which personally, I don't recommend that strategy because it comes down to being keen and showing some effort. But there are going to be people who do that. No judgment here in terms of what your priorities are in terms of clerkship. So is your goal really just to pass that final exam? In which case, you're going to tailor everything towards that. So as I mentioned, I have 3 main goals, and I'm going to talk about the last goal that I had, which was passing the exam, and how to know enough material for that portion. What I do is that I look into the objectives that UBC has set out for us. So I have a list of objectives on the computer behind me, and what I'm doing is going through each one and making some flashcards about what they are, just so I know the bare minimum essentially of what UBC wants us to know for that exam. What are the indications of intubating someone? What is a rapid sequence intubation? So because I know those are objectives, I at least know to focus my learning on those things. Whatever your strategy is, it doesn't really matter. But I think the important thing is having some sort of strategy in terms of how to approach learning in 3rd year. One of the reasons why I'm choosing to do this method where I'm making flashcards is because it allows me to easily reference back to them next year. For example, if I do some sort of general surgery elective next year, I can go back to the section of general surgery notes and just run through the flashcards maybe the week before my elective. And then at least I'll have some sort of refresher about what I'll be doing and what to know. One of the biggest differences in clerkship is when to actually find time to study. So really what you're doing is you're working a full day, essentially a full-time schedule, and then all you have is the evenings to study. So this year, instead, what I'm trying to do is to keep up with our academic sessions. We have an academic full day or an academic half day, and that gives us the foundation of what we need to know essentially, or I should say theoretically, for the exams. I'm gonna head to the gym right now just to get a break from studying.
I need love, love, ooh, ease my mind, and I need to find time, someone to call mine. My mama said you can't hurry love, no, you just have to wait. She said love don't come.
I find that I don't spend a lot of time during the week at home studying because I'm just exhausted. I would rather do things like this. But it's important to keep in mind that you're studying every single day you're at the hospital. This isn't like pre-clerkship where you sit in lectures, it's passive studying, you're not really retaining information, at least for me, which is why I didn't like lectures. I read around every case that I have at the hospital, or at least I try to, especially at the beginning. And then once you start reading around cases for the first week, a lot of it is repetitive. So for the next few weeks, you see similar cases over and over again. So I might see cholecystitis in my first week of gen surge, I'll read about it, but the second time I see it, I won't have to read about it more. It becomes more of an active recall situation. So the reason why I don't study a lot during the week is because I'm studying every day at the hospital. So for those of you who feel bad because you're not studying every moment of the day or when you can, I have to say, just don't feel bad about it. One other part is that when you're at the hospital during your rotations, your supervisors or attendings will ask you questions. And if you're the type of person who wants to know the answer to every single question, you're gonna be studying forever in your free time. Can you stop ruining my video? But I think a part of medicine is getting used to not knowing the answer to every single question. And at the end of the day, if you're okay not knowing everything, then I think it's gonna be better for your mental health. Just be smart in the way that you're studying. I'm not gonna sit down at the end of the day and study pancreatitis for 2 hours unless I had a patient that presented with that. It just wasn't the way that I learned. And I found that if I looked up everything, I would spend way too much time. But what I did do is that if pancreatitis was one of my objectives in the academic days, then I would cover that during that time. So by using these methods, I felt like I was able to cover everything that I needed to in some way, shape, or form. The good thing about having flashcards is that there's a lot of downtime in clerkship. Whether it's waiting for the next surgery to start, waiting for your preceptor to come so you can present the case to them, whether it's waiting for a patient in the ER. There's so many instances where you're sitting, not doing anything, but you don't have enough time to pull out a laptop or take out your iPad and things like that. And because I always have my phone on me, the benefit of having these flashcards is I can just sit, even if it's for 5 minutes, and run through like 20 flashcards. And by utilizing my time in this way, really trying to make my day the most efficient that I can, so using those small bits of time instead of just scrolling through Instagram or Twitter or whatever it is, I'm able to spend less dedicated time outside of being at the hospital studying. So, how do I actually do this? Let's dive in and see what I do. I ran at a daylight yesterday. So what do I actually do with Anki? In my last pre-clerkship study video, I explained how I normally have different areas on my screen. So I kind of do the same thing here. I have more screen real estate now, which is beneficial for me. But basically I have my objectives here. That way I know exactly what I'm going to be working from. And then I usually have some other page open over here, whether it's up to date, it's kind of like a Google for medical professionals, or I'll just have regular Google up if I want to search things quickly. And of course, I always have some music playing in the background, so I have a Spotify open there as well. And then I normally have another source, some sort of quick question, high yield facts, just so I can run through. I'm not copying any of those facts down into flashcards, but it's just another resource where I can go through some mental questions to retain as much information as possible. So right now I'm using, I think it's called Surgical Recall. Yeah, so it's the 8th edition of Surgical Recall. One reason why I like this book is because basically before any surgery I had, I would just go through the questions, made sure I knew the answers, and then I would cover most of the questions that the surgeons would actually ask me during the surgeries, those so-called pimping questions. So back to the setup. One other thing is the other resources that I use. So I have Toronto Notes here. I mentioned this before, I still use this resource. I find it to be laid out really nicely, it's really clear, and it has everything that I'm normally looking for. And then depending on what rotation I'm on, I usually use another text. So starting anesthesia, we were told to read this book, which is called The Ottawa Anesthesia Primer. It's by Patrick Sullivan. So I essentially have this because it's a recommended text from our school, and all of the anesthetists expect us to read through it. Okay, so I have that book there. And then I just have another small book here on Blueprints Anesthesiology. It's not really necessary, but basically it's a short version of the Ottawa Anesthesia Primer. It's a little dense and I don't really want to go into that much detail for this. I just want a quick way to find all the answers. So, how I do this. The first thing on my objectives is describe the key differences in pediatric patients compared to adult patients in regards to airway anatomy, respiratory physiology, and cardiovascular physiology. So basically, what's the difference between a kid and an adult in terms of providing them with some sort of anesthesia? All of these books have a section on pediatrics anesthesiology, which is very convenient. I always go to Toronto Notes first. Specifically, it talks about the respiratory system. So perfect in comparison to adults. Anatomical differences in infants include, and then it lists things. It lists the cardiovascular system, and then it goes on, so on and so forth about the other systems as well. Because this is enough for me, I don't have any questions. This is pretty clear laid out. I don't even need to go to the other books. These are basically my supplemental resources if I can't find what I'm looking for in Toronto Notes. And then this is what it looks like. So I use closed deletions on Anki. Then I just run through all the objectives, highlight them as I go along, and that way when I'm finished it, I know I'm done with it. The benefit I find to this is that if I have to stop, go do something else, I can always come back and know exactly where I left off. That's essentially my studying in clerkship in a nutshell. Once I have all of this done, I actually have the Anki app on my phone, which is why I'm able to go through these flashcards at any time. A quick aside, this is a future Privia who is 3 days? I guess I'm actually 2 days out from my exam now. One thing I just realized though while I was studying is that I completely forgot to explain what I do for the other half of my studying. So as you just saw, I talked about making flashcards. I only go through flashcards during the workday though. The other part of my studying though is going through questions, which is quite important, and I completely forgot to talk about it. I'm going through all these flashcards during the day. But after work, what I'll do is I'll spend a couple hours just running through practice questions. And I use different sources for that. So at UBC, for example, essentially they give us a bank of questions to run through for each block that we're on. Another thing that I'll go through is board exam reviews. So whether it's USMLE board reviews, the MCCQ, I don't even know if that's what the exam is called because that's way in the future and I'm not too worried about that. But basically I'll go through questions that prepare you for those exams. I think one of them is called NMS Surgery Casebook. Case filed is another set of questions that I'll go through. So another thing I'll do is find books that have multiple choice questions, so it's a lot easier to study for the type of exam I'm going to be writing. So this is actually another NMS surgery book, but it's not case-based, it's question-based. So I'm going through that. And then I have one other that, so I think it's called Dr. Pestana's Surgery Note or something like that, but that's another book that has multiple choice questions in it. So essentially I'm consolidating my learning and then I'm going through questions in the same way that the exam I'm going to write will ask us the questions. So that is actually my studying in a nutshell. The Anki cards and then the questions, which are really important. Okay, so back to previous Privia, and we'll get back to the video. I hope you found at least a little bit of that useful. If anything, it at least shows you that you don't have to keep the same studying method once you've chosen one. For me, I didn't have the same luxury as I did in pre-clerkship in terms of time available to me. My method of writing notes took so long before, and I just don't have that type of time. Also, as I mentioned, clerkship is completely different. We spend every day at the hospital, we spend every day running through cases, real life cases, so the studying essentially happens throughout the day as well. So I don't have to put in the same amount of time and effort as I did before. But I do put in a different type of time and effort, which is an important distinction. Other than that, I hope you enjoy the rest of your morning or evening, lunch, whatever you're doing right now, and I will see you in the next one.